And so what we'll be focusing on today is being data-centric, using a whole agency data approach. And we have a couple of subject matter experts with us today to talk about this topic with us. And so I'll be introducing them here a little bit later, as well as digging into our content for today. But as we get started, I want to go ahead and give you a few technical or logistical notes. As we go throughout the webinar, we definitely welcome you to enter in questions, and we'll be addressing questions at the end of the webinar for sure, potentially throughout as the panelists see fit. And so how you can do that is simply by entering those into the chat box. And if you would, please enter those in using the All Panelists option in the drop-down menu. If you have any audio issues or computer issues, with the webinar platform during the webinar, we do ask that, if you want to let us know and we can help you troubleshoot, then you can send those directly to me, the host, or we also have another teammate from the partnership on Hyacinth McKinley, and either one of us can help you troubleshoot any audio issues or WebEx issues as well. And then lastly, like I mentioned, we are recording this webinar and slides will be available after the webinar as well. I did go ahead and send a link in the chat box to let everyone know where the slides are posted. They're already posted to our Community Action Academy site. So if you do have an account for that site, you can log in and go under the Learning Community and then go under Open Learning Community Groups. And then you can choose the Cultivating Data-Centered Organizations group to access the slides for today. And then I also sent that direct link in the chat box as well for those of you who can just go straight to that slide deck that's in there and log in. If you don't already have an account, those accounts are free, so you can create that free, quick account to be able to access all of our learning community information. So as we get started today, I do have a few introductory pieces, and we always like to start with the promise of community action because it really grounds us in the work that we do. So you can say it with me there at your desk. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. All right, so our agenda for today, first we're going to give a little bit of information about our learning community in case some of you are not familiar. We're going to give some introductions to our subject matter experts, and then we'll dive into our topic for today, which is about being data-centric, using a whole agency data approach. Of course, we will answer any questions that you might have, and definitely want to hear some feedback from you all on what we're going to be talking about today. And then we'll let you know what's coming up as far as meetings and webinars for the learning community. So the purpose of the learning community is really to basically help the community action agencies throughout the nation build capacity to fight poverty. And so by doing this, we really want to help agencies, analyze the community action outcomes and identify effective, promising, and innovative practice models that help to alleviate the causes and conditions of poverty throughout the communities in the nation. And so our Community Action Network Theory of Change is really another piece that kind of guides the work that we do for the learning community. And so we're focused on individuals and communities as well as families through our national goals at the top there. And then you see those different services and strategies that are deployed throughout the Community Action Network. Of course, being unique to the local communities based on what needs are found in those areas. And then, of course, we have our core principles and our performance management framework that we obviously keep in mind as well as we deliver these webinars and topics and learning opportunities for you all. So our learning community, we have several different opportunities to engage. We have 4 different open learning community groups, which can be, people can apply for those at any time, and they can we hope that you engage through the whole learning community, but you can also, if you miss one, it's not a huge deal. We always record these, and so you can catch up, and all of this information is on Community Action Academy as well for people to kind of follow. And so those are open and accessible to anyone, those top 4 listed there. Today we are focusing on the Cultivating Data-Centered Organizations Learning Community Group in this Webinar Wednesday event. And then we also have some more intensive learning community groups that require an application process and more of a time commitment, as well as a goal planning process. And so you can see those 3 listed here on your screen. And then we have some community of practice opportunities as well, which are also application only. The Rural Impact just completed, actually, but they are kind of starting to rope into the whole family approaches, learning community groups and community practice as well. So that's kind of how our learning community is set up and the different topics we focus on. Of course, through these Webinar Wednesday events, we invite you to learn about these topics as well as we kind of rotate through these different subject matters. We also wrap in a lot of different framework components. You're going to see a few of these today with data analysis, data collection, and just this really, of course, the focus around data for today. But a lot of our other webinars we focus on through a lens of racial equity, family-centered coaching, of course, Roma, and so you'll see those reflected throughout our learning community. What we're made up of across the nation, we have representation in all 11 regions, 33 states, and 407 counties, and so you can kind of see how diverse our network is, as well as the learning community participation. So kind of what we're all about is small actions, lots of people to create big change, and that's what we really hope to achieve through the learning communities, and hopefully you'll learn something that you can kind of take back and start to make some small actions around being data-centric, and as lots of people do that across the nation, we can achieve that change that we're looking for in being more data-centric as a network. So our Learning Community Resource Center team is made up of several individuals that work together to put on these webinar opportunities and operate the learning community groups. And so you can see those here on your screen. I am Courtney Kohler. I'm a senior associate with the Training and Technical Assistance team, also with Learning Community Resource Center. And so I'll be facilitating this webinar with you all today. Our 2 subject matter experts, as we start to dive into the content, we have Dr. Barbara Mooney. Her primary role in the network, she's the director of the Association for Nationally Certified Roma Trainers, but she also serves as a primary consultant and subject matter expert across many of our different learning community groups. Then we also have Paige Teagarden, and she is the general manager of the CFST software. She's also worked with the Community Action Agency in the past, and she has also been working a little bit on the Community Action and Economic Mobility Initiative through the CADIO data piece. And so we welcome you all today as you're going to be presenting us with some good information. We thank you for joining us, and we'll go ahead and dive into the webinar objectives. I'll quickly go over these, and then I'll turn it over to Barbara Mooney to get us started. So what we're going to be focusing on today is really looking at kind of those benefits and challenges facing agencies who have begun to move data to the more data-centric approach. So we'll have a couple of actual agency examples in the network of agencies that are working towards this or have achieved some change in this area. And then we're going to be talking about some general ideas about establishing this approach, and then also some different case studies that talk about why these agencies that I mentioned decided to make this move, what they changed, what they observed in the process, what their motivation were, and that sort of thing. So we hope that this is going to be beneficial for you, and we'll go ahead and go into what being data-centric means. So Barbara, turn it over to you.
Thanks, Courtney. Good introduction to the learning communities and to what it is we're trying to accomplish with our webinar Wednesdays. The first thing for us to talk about really is a review of what we've done. Because this is an open learning community, I'm going to repeat a few things that we've talked about in prior sessions just to get us grounded so that the participants for this call are all on the same page. So we have developed with the learning community participants in the past what we're calling some core values that actually characterize this concept of a data-centric organization. And it has to do with several kinds of actions that happen in the agency. One of them is about decision making, and that the idea of a data-centric approach is that decisions are based on verifiable data. Those of you who have been part of the discussion in the past remember us talking about that if you don't use data to make decisions, you're using opinions or gut reactions, and you're not able to necessarily support those decisions with data like we feel would make your decision making more positive and more useful. The next value is that data, that verifiable data that you base your decisions on, has to be accurate. It can't be incorrect. It has to be accurate. It has to be reliable, meaning that the data has to be collected in a reliable way. It has to be timely. It can't be old data. It has to be current data. Unless you're making a comparison, and then you would be comparing old and new data, but you need to know what the time frame is for the data. And it has to be complete. If you're looking at a set of data that's incomplete, your decision making may not be as correct. The next point is that there's this concept requires a management system that really monitors and provides follow-up for data collection, data entry, data storage. And in the later discussion today, you're going to hear about some agencies that are moving in this direction, and you'll see that they spent quite a bit of time thinking about the management system and the follow-up on data collection and entry. And then that there's a system or a process to store, retrieve, and aggregate data so that it can be analyzed. We talk about the analysis of data, but it has to actually come together so it can be analyzed. And then just a couple more things I want to tell you on the next slide are some things about the organizational culture. We spent one of our calls talking about organizational culture and how it needs to reflect certain qualities, and one of them is that the organization embraces data, and that data is important to the leadership and to the and to everyone in the organization, that there's a data focus, meaning collection, storage, aggregation, analysis, and use of data, that's in all of the standard operating procedures. It's not something extra, it's not something that's added on, but it's a part of the activities of every part of the organization. And that the data, you know, people say, oh, I'll see what the data tells me. But data doesn't really talk to you. You have to take the data and analyze it and turn it into information so that you can support this decision-making and decision-making in everyday operations and in long-term strategic planning as well. So how does this happen? I'm going to turn the program over to Paige Teagarden, and she's going to give us some ideas about how it happens from her observations.
Great. Thank you, Barbara. I want to say a word about organizational culture as I go into this how does it happen part, because organizational culture is based on successful experiences. It doesn't come out of thin air. It is developed over time as the organization successfully does things, and the beliefs and assumptions that are behind that. Then culture is conveyed through the stories that we tell, the narratives that we tell, whether they're by the water cooler or in our newsletters or, you know, in staff meetings, and then it's enforced by behaviors. So now when I look at this, some of the ideas about how it happens, the core principles like clients own their own data. Ask me once, use the data many times. How many times are we asking clients for their name and their date of birth and their address? How many times have we heard, that's my data, like that's my Head Start data, or that's my housing counseling data, or that's the funder's data. It's the client's data. We're stewards of that data. Or data is an asset for the organization. You know, is that what people think? Is that a belief right now, or is it more like data is really done for the funder, or it's really done for leadership, you know? So thinking about, you can't just say these are new principles that we believe as an organization. So think about, are there ways, are there experiences that you could create that ask me once, use it many times could be true, right? And then once you have that experience, tell stories about it over and over and over again, right? Because that's how you start to shift those cultural beliefs. These are a few principles that maybe you can think about. How do we talk about them? How do we bring to light what we really actually think about these ideas? Bringing in, making them visible can help. Having experiences can help. And then the enforced by behaviors. So culture is managed by leadership, should be managed by leadership. And so while you can't control the behavior of every single staff person at every single moment, hopefully you can control your own behavior and maybe some of your leadership team and model what it means to be data-centric, to ask, well, so where did you get that information from? Or can you show that to me? Or did you know, what was the basis of that? And if they say, well, you know, we know that. We've always done it that way. Those aren't data-centric. So model, you know, showing how you use information, and that helps to reinforce, again, because culture is enforced by behaviors, it can help to reinforce that. Next slide. Oh, can I do it? I don't think I can do it. Courtney.
Yes, I handed it over to you, so you can do the little blue arrow at the top by the number 16.
Okay. Okay. So you've heard and talked about the idea of theory of change, about your big picture results, and the things that are necessary in order to get to those big picture results. And so thinking about, where does your data fit into that? Where does it fit in? And are you making assumptions right now about who has information at particular points in time? What data are you using to monitor whether or not you are making progress towards those outcomes, right? So there's a lot of uses in that, and if you think about your theory of change and just sort of at each point along the way, think about your data and the systemic ways that you collect, store, and analyze it at that point in your theory of change. It can be a helpful process in terms of making it a little bit more universal across the entire organization. And you also want to have some conversations with your partners and funders about those big picture results and about the way that you are actually operating. How do you collect information? Does this client come in? Do you write it down on paper? Then where does it go to? Who has access to it? If your partner needs access to it, how are they getting access to it? If your funder needs it, then can you get it to them in a way that doesn't require your funder telling you exactly where you need to enter and store the data? Can you get them what they need without them having to make that kind of a mandate for you? Next, let's see. I can click the little thing. Couple of benefits to being data-centric, and then you'll hear more about this, I'm sure, as the agencies themselves talk. But if you're really using information along the way every day, then you can make continuous small adjustments in programming that can lead to better outcomes for your clients. You can use the data for new initiatives. And so I have a couple of examples. One is an agency that I was talking to, and they were like, you know, we think, as in the census is telling us, there is an increase in seniors in our area. But we've been here a long time. We directors have been here for a long time, and seniors don't come to us. That's not sort of our population in this case, in this organization. And so there was a grant opportunity about serving seniors, but they didn't think they should go after it. Well, they used data from their data system to actually show the percentage of seniors that were coming to them was increasing over the last couple of years and was actually a pretty large percent. So they used that to actually form a new initiative. Excuse me. You can also use data for keeping the public trust. It's really important today. We can't just say we do good things. We all know this. But what do we say to the public, our community? What do we say? The more we can say, paint the picture of the folks that we serve, not just the individuals, right? The stories are important, don't get me wrong, but to be able to say overall, we served this many clients. They looked like this. They were situated in these locations. They had these kinds of circumstances. And this is what we did for them. It can really help keep the public trust, especially as you break it down kind of by city or zip code or county, and you're talking to that audience. It can create efficiencies for staff and customers. So being data-centric is not only about outcomes data, right? That's important, but it's not only about that. It's also about, can I collect this information at the moment that the client is here with me in front of me, not have to write it down and then therefore do something later? Can I print something out of a system that helps save being able to having to write it down? Can I send something so that I don't have to type it up later? Can the customer not have to come back to the office and bring their driver's license because they already gave it to you and you scanned it in? So that's also being data-centric, right? And then better use of funds. I have one example here that's kind of fun. Some of you may have heard this because it comes from an active member of some of the learning communities. But in this case, there was a conversation going around in their local area about the need for more three-bedroom apartments, affordable three-bedroom apartments. Housing is really expensive in this community. And this organization had access to a data set that was probably 50% of the people that would qualify for affordable housing units, right? So the percent of poverty, they knew from census it's about this many people. We have about this many people in our database that have that characteristic. And so when they looked at it and analyzed, that's a pretty good sample set, right, at 50%. So they looked at the size of the families and did some analysis and calculations, and were like, yeah, we don't actually need a whole bunch more. We might be able to use a unit or two, but we don't need a whole new complex built with three-bedroom units in it. So then they can make the argument, well, so can we use those funds? Because this was a community conversation, right? It wasn't a single purpose use of funds. to do shelter sometimes, or helping with progression of folks out of shelter and into to more stable housing. The last one here is about a whole family approach and thinking about data not as isolated individual people, but as people in the context of a family unit. And that can provide some additional context for case coordination or mentoring or coaching, which also often goes with the whole family approach. And challenges. So it's not an easy thing to make shifts in organizational culture. That's particularly true when so many of our agencies for so long, we didn't need to use data every day, right? We did good work, we had volunteers. The world's changed, but our foundational beliefs are a little slower to catch up, so it's hard. It's hard because, so in this first one, adults and children are often tracked separately in separate systems. It's not just adults and children, right? It's sometimes every single little program is tracked in separate systems because at some point a funder thought that was a good idea because it met their their programmatic need, not necessarily the agency need. That can be a challenge. I can come back maybe at the end and talk a little bit about some mitigations for that. We've already talked a little bit about multiple systems in the agency, making it difficult if they're unwilling to communicate with one another. Staff buy-in. So I will say that one of the ways that you can help get staff buy-in is by meeting their need. And I'm going to talk closer to the end about the different audiences for data, right? People use and need different kinds of data. So if you're trying to get frontline staff buy-in to enter good data, then goodness gracious, think about what they need and what will make their job and life easier in terms of data. And can you do that for them? Can you do a small little piece for them? Because that helps them see the value of the system. Having job descriptions and responsibilities that reflect the change in the world today, that we probably are going to have to use computer systems, we probably are going to have to interact with data and information in some way, shape, or form, and so making sure that that's clear in your job descriptions and responsibilities. And data-centric, look, it's really hard for us as agencies, as community action agencies, to make the case that we're different from other agencies because we're holistic, because we have all of these programs, because we have access to this variety of possible programs to braid around families, right? It's hard to make that case if we're talking programmatically all the time about our data. We've got to be able to talk about our data not just programmatically, but at that higher agency level. And so understanding services provided to all of the different family members, understanding the services across different programs, and being able then to do analysis about, you might find that some strange correlation of services is yielding a better outcome, and you would never know that without being able to get to information from multiple programs. And it obviously can be difficult to get funding to build some of that initial capacity and supporting the shift in either systems or in staff training, making the case that that kind of funding is critical to your agency can be a challenge, can definitely be a challenge. And I think I'm turning it back over to Barbara.
Yes, you are, but I had to unmute myself. Sorry. Thank you, Paige. That gives us a good foundation. And our next little segment here is going to talk about a couple of things that we've heard from the field. We ask, oops, I went backwards, I think. Sorry. Okay, here we go. We asked agencies to think about the kinds of changes that they saw as they moved towards this data-centric approach. And a couple of things that agencies said generally had to do with how they actually brought customers into service. So intake, or how enrollment, or whatever you'd call that, introduction of the customer to the agency. That whole process was something that many of the agencies talked about. And then there was a lot of discussion about communications, internal communication, what people in the agency needed to know, and external communication, what needed to be communicated with partners. And then other things like staff development and software challenges and hardware and funding and other kinds of things that were processes and practices that needed to be looked at and understood. And then, of course, organizational culture, as both Paige and I have talked about. We wanted to know what changed for people, and then what were the decisions that became data-based. So we've had a lot of interaction from the field, but we picked out a couple examples for you today, and Courtney is going to talk about one of these agencies. And Courtney, do I move you?
Yeah, since I only have a couple slides, then
okay.
I'll just say next slide to go to the next one.
Okay.
So the Community Action Partnership of Kern, they are a participant in the Integrated Services to Improve Impact Learning Community Group. It's one of our intensive learning community groups. And they are currently in the process of goal planning right now. So they've recently completed their first draft of a goal plan. And whenever we were starting to review some of the goal plans, we identified this one as a good example of how they are working to not only integrate services, but they're taking a data approach to integrating services. And so what they were determining here, of course, we, just like Roma, we teach in the learning community goal planning process to start with the needs. So, what is the motivation for change? And so the needs that they determined are listed here on the slide. And we're all really agency level needs around data. And so they were saying that, the agency lacks tools to respond to a changing nonprofit environment that's leaning towards outcome and data-driven information. They were also saying that the agency lacks coordination and standardization in data collection, that they lacked an integrated software system, and then they also lacked a centralized client intake system. So a lot of these things that you've seen reflected through some of the previous slides and information shared, they were saying that, these are kind of the things we're lacking. This is our motivation for change, that we feel that we are needing to gain these things, and we need a plan of action to determine that, and then that therefore is how we're going to work to integrate services across our agency, is by using kind of this whole agency data approach. And so their broad goal as a result of identifying these needs was that, the Community Action Partnership of Kern aims to develop specific methods and tools to assess needs and analyze, track, and use information to manage and improve services, enhance workflow, and collaborate across multiple programs and databases. So that's kind of their overarching goal of what they're going to be working on in the learning community. And then on the next slide, you can see that they, started going into, after they determined their needs and then their outcomes and overall goal, they determined, okay, what are we going to do? How are we going to address those needs and achieve this change that we're looking for in our agency? And so they determined some strategies, and these are just a few that we picked to show. But what they set out to do, their current strategies are that they're going to first assess, their current platforms that they have and used by programs, including, human resources and finance. And then they're going to identify program requirements and start to crosswalk similarities among programs pertaining to data collection. So then, providing recommendations on next steps, which may or may not, look at integrating software systems. Then they also talked about identifying how their data is used. So looking at the reports and, how those are generated, what purpose, how the information is shared, whether it's electronically or hard copy, verbally. And then they also, were thinking through how else data is collected and reported and used, either, externally or internally. And then we have a few other strategies that aren't here on the screen, but that they have talked about doing to be able to achieve this overall goal of being more data-centric and integrating their services. And so they also talked about, collectively deciding on the direction that the agency would like to go based on assessment, creating a budget, and identifying how program funding might be allocated, and of course looking at how that's allowable, assigning leads on projects and including subcommittees, so being, very organized in their approach. Of course, looking at creating timelines and deliverables around all of these things to make sure that they stay on track. Deciding on information that might be required for centralized intake, including, CSBG and other funder priorities, so making sure that they're in line with program requirements to see how all of this can work together. Looking at integrating reports and meetings with their IT steering committee, providing updates to managers and supervisors, and then beginning research and potential bid process for vendors. Of course, creating an implementation plan, as well as, how they're going to adopt it and then use it. And then, of course, then reporting monthly on progress, including challenges and barriers. So really kind of covering, from a ROMA standpoint, where they're going to assess what they already have, assess, those, identify those program requirements and what, kind of what lanes they need to stay in, crosswalking, their similarities of what they already have, and then creating kind of this plan to move forward based on all of that, and continuing on to implement, and have those results, and then report out and be able to evaluate. So it is a process, and I think, of course, agencies realize this as they start to, move forward on these kinds of things. It doesn't just happen overnight, and like Paige was mentioning, and Barbara, is the kind of that culture shift. But this was a pretty good example of how an agency is working to integrate, but using kind of that whole agency data approach. So Barbara, I'll go ahead and hand it back over to you, and you can build on that or go on to the next example.
Yeah, so I think that's a really good example of how an agency approached this process. We have another example. This is York County Community Action in Maine. And we do have Megan Ardberger on the phone. She's going to say a few words about what they've done. But their approach was very different. They started with an understanding that before they did anything, they had to have their staff had to understand this concept of the why behind the approach. And so they sent staff to training. They worked with a group in Portland that helped them to identify needs, and they really got people talking. And I think the best example of their approach is that they started from a place of curiosity, and I think that really says a lot about how things work in an agency. That if everyone's talking about something, everyone's curious about something, then the steps can be followed at a later date. So I'm going to just see what's on the next slide. Their mission is to create a centralized database, and they have some specific ideas. But I'm going to see if I can unmute Megan, or if Megan can unmute herself. Yes, and
yep,
see what. Okay, good, good. Would you like to talk a little bit about your approach and where you've gotten with it?
Yeah, I guess I would just emphasize a lot of what's already been said, that you have to be really intentional in this work, and that it really does take a lot of effort, and that it's not something that, you know, you just put. I guess what I'm trying to say is, don't assume that by putting a database in that that's going to be the answer, because it's not. That it really does require having a team that is thoughtful about data, that you have a culture where every single senior staff meeting that we have, we discuss data, we talk about trends, we talk about what's happening in each program, and just seeing what's in front of us, even outside of databases. Like every time we are thinking about making changes of any program, or even understanding what's going on existing in a current program, we pull out the data. We always are looking at it, and it's become just a regular practice in our agency. And so we really just started with what we have, and that's what I would recommend to anyone, is don't feel like you have to build out this massive infrastructure for collecting data. I think that you can start to develop some of that infrastructure as you go, but start with what you have, and my guess is you have a lot of really good information already at your fingertips, and so start using what you do have, and start developing that culture where every time you have a meeting, you talk about it, like what's going on in this program and why, and be curious about it. I will say that we have set up multiple committees that meet. At this point, we're meeting every 2 weeks, which is a lot, but we're trying to, at this point where we're still trying to get a lot of pieces off the ground and developing our centralized database, we have dedicated every 2 weeks, we have about 14, there's 2 different committees, we have about 14 staff people dedicated to looking at data, thinking about how it's affecting programs, and thinking about the technical side of it as well for us as we roll out our database. So I just wanted people to know that it really does require an intentionality and a thoughtfulness, and that, but we're finding that it's really been worth it. And as Paige already mentioned, you know, there's grant opportunities involved. We've already connected with a lot of we've developed some new partnerships within our community because of the data that we have been looking at and thinking about. So it's been really valuable.
And I like that you talked about the differences in your committee structure, that that you had one group that was looking at technical issues and one that was looking at program issues. Do you want to say anything about that, why you thought that was important?
Yeah, so I mentioned we have 14 people working on it, but half of them, actually about 3/4 of them, are focused more on the program side of things and looking at data and understanding not just the data, but how our collection process of information works, as well as reporting process, so workflows, and how we're building that into the day-to-day work structure. And we thought it was really important that those individuals have a say in that, because they're the ones who are on the ground trying to make it work. They're meeting with clients, and we need to understand how any additional questions or data points or anything that we're trying to throw at them would actually impact their work. And so, and to really understand, what do they need to do their jobs effectively? What data points are important to them being successful in their work? And so it's really important that we had a team that's really on the ground, more the programmatic side of things, thinking about data, in addition to a separate team that's more focused on the technical IT side of things, trying to put those technical pieces in place for collecting that information.
Thank you. And I don't know, Courtney, have we gotten any questions, or are we getting any questions that you see?
Let's see, I'm going to check the Q&A box as well, but it looks like nothing related to content yet at this point.
Okay. Megan, did you have any last comments that you'd like to make?
No, I think that's it. I'm happy to answer any questions anyone has.
Okay, good, good. All right, we'll see if there are questions at the end. So hang on here. We're gonna move on to talking about using data. That really you have. We've talked a little bit about collecting data and storing it and aggregating and analyzing it, but really the key to being data-centric is to use those data elements for decision making. So Paige is going to talk to us a bit about actually using data.
Thanks, Barbara. In some ways, I could say, just go back and re-listen to both of the two agency reports we just heard, because both of them did a really nice job, and I'll tie those together in just a second. So what's funny is sometimes when we think about being data-centric, or maybe it's just me, but think a lot about outcome information, which is super critical because we have to know where we're going, right? We have to know what we're shooting for, and we need to monitor sort of progress towards that. Super, super important. Becoming data-centric involves using data in multiple ways, though. And so far, I think of it in these three kind of big buckets or big tags. You use data in planning. And so the Kern report, the Community Action Kern report, was really about using data and information to create that goal plan, to think about what they're going to do. You might use it in your community action plans, right? You should use it in your community action plans. And that's data, not just census data or data from your local economic development office, but it's also data from your own systems, right? That's one of the values to having it in some systems that you can do analysis with, is because then you can actually use that in your planning processes. So that's one way that we kind of can think about really using data. And in some ways, you know, Megan was talking a little bit too about how they're thinking about data as they're planning program changes. So that's sort of the next category, and maybe these aren't entirely clean, but this idea that we need to be watching how many people come through our doors, our kind of output, how many people got this service, what was the quality of that service, how frequent did people come back, how efficiently, in other words, how much time did staff need to spend with on certain pieces of a client process, right? That you need to manage program and services kind of processes. And I loved that York was thinking a lot about how do we infuse our understanding of data and the flow of data within our normal work processes, right? The normal operations of programs and services. How do we do that, but using data to make that more efficient or to make decisions about small changes, continuous improvement? So I'd say that's a second area that maybe we don't think about as much. And then the last area is that outcome or progress, you know, change, evaluative uses of data. So really thinking and looking at what is change in the kind of participant or participant status, whether you're measuring that through assessment or whether you're measuring it through income or whether you're measuring it through particular data points like readiness for kindergarten or housing stability, that you need to be looking at that alongside the program services kinds of information that's coming from your systems as well. And that outcome and progress evaluation, you notice I didn't say the use was reporting. It's like, yeah, it is, that's true. But really it's about being evaluative in understanding what's happening. Change for whom? when, why, that curiosity part, again, that Megan mentioned. Okay, so I briefly mentioned this, but I think sometimes it's helpful to literally have different audiences, different groups in mind and think about them when you think about data and becoming data-centric, right? What do frontline staff need? What information do they need? When do they need it, right? How can the systems that you're putting in place, technical, IT, software systems, and regular work process systems, how can it meet that need for the frontline staff? How's that different from what managers and directors need, right? When do managers and directors need that data? What data are they going to monitor? And I loved that about the Kern report that they were talking about exactly. They were going to plan out what information, program specific and otherwise, that they were going to be looking at. What does the senior leadership and board need to see? That's much more likely to be aggregated information. It might be more trend and comparison analysis information, which it's not to say that frontline staff shouldn't see that, but that may be less pressing to them being able to be effective in their jobs than it is for senior leadership and the board. What do funders need, right? It's a little bit different again. They want to make sure that you're using the money effectively and, as you said, and that you're getting either outputs or outcomes as appropriate to the money that you receive. The community itself, right? If you're going to use it for communication strategies, then that's different. That data is different. And so it doesn't mean that you're only collecting data that you will use in communications. You're only collecting things that would be, good talking points. No, but you do need to think about using it as good talking points too, as it comes out. And so sometimes I think understanding these different audiences and thinking about their data needs, I almost think of it in a matrix, can be helpful. I'm going to say one other thing about audience, and that's got to do with IT kinds of capacity versus, I don't know, I've been calling it data managers, but I'm thinking about shifting that to data shepherds. So this idea that you don't necessarily need to have somebody with a heavy IT background as the leader of all of your data work, because they may not know the programmatic side very well, right? And so I think of data shepherds as people who have data talent. They think that way. They can think in the ways that numbers logically flow together, and but they don't have to be like computer geniuses, right? And they don't have to have an IT background to be data talented and have some program access or experience, and that role, that kind of developing that data shepherd talent can be super helpful in moving into a more data-centric approach. So this could be really long, but I'm not going to make it really long. So if we're thinking about, all right, most of this is about becoming or moving on down the path of being a data-centric organization. And so we've talked about lots of different aspects of that. This is a slightly different frame for thinking about the data that you actually need, right? The data that you actually need. So it's not quite so much about becoming data-centric as it is one piece of that is understanding and thinking about the data that you are going to be using and understanding that well. So one of the first steps is this sort of why. Why? What's your vision for using data and information? What's that big picture vision? How is it going to be more effective, efficient, impactful to your clients, better for your agency? What's that vision for the use? And then what is the information and for whom? And that's a little bit getting into those audiences. So the what and for whom has to do with understanding what group of clients you're talking about, and who needs, and who in the staff side needs information and data, right? So why, and then what and for whom. And then the when and the where is about that client flow meshed with the data flow. So if you think that part of your data vision is that you ask once and use many times, then you need to know when you're actually asking the question, right? And is that the same in every program, or is it vary? You know, are there some questions that you're not asking at all in some programs, and that's okay. So when are you asking that question? When are you collecting that piece of information, and where is it going? Where is it going? Is it going onto a piece of paper? Is it going into the staff person's head? Is it going into an Excel sheet? Is it going into a database? Meaning into a piece of software that then feeds a database. Where is it going? You need to know that for step 3, which is about the tools for collection and the softwares that you're using, so that if you're going to get it together to do analysis, then you need to know where, and you need to know how much control you have. How much control you have over that place, whether it's a database or, you know, the drawer or somebody's head, or, you know, a software that your funder owns. So you need to understand that. And then as you bring those different pieces of information for planning purposes, planning around your data, then making it into bite-sized chunks. So thinking, as Megan said actually, that, you know, start with what you've got. We collect a lot of information. Don't let the barrier of many systems, not enough time, you know, whatever those are, be the reason that you don't start. And so kind of bringing it into bite-sized chunks that you can use. I think, Courtney, if I didn't send these to you electronically, I will, but I have a couple of worksheets that I developed for the Whole Family Institute that this is one. There's 3 parts to it. This is part 1. That is just different ways of moving you through some of those steps in order to get a handle on what data do you have, where is it, what do you need, who's going to need it, when are they going to need it, so that then you can make a plan about actually analyzing and using it in a more holistic fashion, right? Because you don't want it to just be at the end of, you know, each year that you're getting this all together and looking at it. You want it to be more regular, or at least some elements to be more regular than that. And so this particular slide is about the vision for using data, because that will help guide you. The target families, because this was about whole family approaches, and so being clear about who you're talking about, which families are you talking about for this data, and then different kinds of data points, outcomes, personal private information or socio-demographic data. There's programmatic data, program and service data, assessment kinds of data, and then income and benefit kinds of data. Are big groups of kinds of data points that are very common across many different programs in terms of what is either already being collected or might be valuable to be collected. And Barbara, back to you.
Okay. So, so what will you do? So I'm hoping that there are some questions coming in, and we'll get some ideas, or we'll get some follow-up after this. But one of the things that you want to do is to really think about what works, what's worked for others that you just heard about, some agencies. If you want some additional examples of agencies, we have other agencies you might want to talk to, but you really want to be able to start with some kind of plan about what will be observed, documented, reported, and analyzed before you do anything else. And the goal planning process that Courtney referred to earlier is a good way, a good document, and I think that document's available for folks if you're interested in seeing that planning process. But you want to make sure that you're planning for what you're going to do, and then you have an understanding that you're going to have to analyze what you have found. And so you can see what's happened that was positive, what happened that what outcomes are from a single service, what outcomes are from multiple services that aren't integrated, and then distinguish that from this whole family approach that really integrates the services. So we're saying that this is a good approach, but in order to understand if it actually is a good approach for the people that you serve, because all the populations that we serve across the country are different, we need to have an understanding of what works and what we're going to talk about. This is the contact information, and the slides are going to be posted, so you'll be able to contact Paige and I, as well as there's a slide later on for all the partnership staff. I'm going to turn this back over to Courtney for the final section.
Sure. Thanks, Barbara, and thank you, Paige. We'll go ahead and address the questions that we see now, and then we can always pause later on to make sure that no other questions have come in. But I do see a few good questions coming through. We had one earlier that Daniel had asked about what are some of the recommended ways for handling constraints imposed by one or two funders on how the data about the customer served with their particular grant can or cannot be used by the agency.
I know that was one of the things that York addressed. Megan might want to jump in on that, and I know that's something that Paige addresses on a regular basis. So either of you want to take that one?
So having a conversation with the right people at the funder and trying to figure out where the actual concern is, right? Sometimes is probably one of the first steps. So really understanding, do they believe that it is in regulation? And if they do believe that, then telling you the regulation so that you can look at it is helpful. Or is it more a concern about security, or is it more a concern about data quality, or is it so having and making sure that you're at a level in those conversations that it's not just going to be somebody who tells you, I don't know how to put that. Never mind. So, so that would be one, and really having a conversation then about what you're trying to accomplish with them. So if, you know, if you're trying to use the information to better serve the client, right? If you're trying to use the information to better serve the client, then is that something that they can get behind? So having those as initial conversations and then addressing where they think the barrier is, if it really is in regulation, then you may have to change the way you collect the data. Like they aren't that program's client yet, right? Do intake in a different way so that you're able to do that without causing a burden or, you know, we're not talking about being sneaky here. We're just thinking about how do you how do you address the concerns in ways that are respectful of the client's time and their own privacy. So I can't say perfectly what it's going to happen with every single one of them, but those are some of the steps that I would start with.
So basically, you want to talk to the funding source and tell them what you're wanting to do, and then decide whether it's something that they can change or not, and then go from there, basically. Yeah. And Megan, go ahead.
Yeah. Go ahead.
Yeah, Megan, I see you've unmuted yourself, so would you like to respond?
Yeah, I agree with everything Paige said, and I would just say that many funders are okay if you do a universal intake process where you're capturing all of that, but you just consider that outside of that program. So basically you would say, I'm not enrolling this person in my program until after that intake has occurred. And so you are able to capture that information and have that in a database or in a location and not necessarily have to get into a lot of the funder requirements because they haven't actually enrolled in the program yet. So there are workarounds, but I want to echo Paige, it's really important that you have conversations with funders and know that honestly, even some of the most challenging funders often have the same goal of supporting the people that we serve. And so coming from that same, to basically just articulate, we have the same goal. We're trying to support people. And so that's where we're going to start from, and we're always going to revisit that every time we meet to discuss sharing of data and information, because I think that helps ground everyone in sort of that, you have a shared goal with one another.
Thank you. Thank you. And I know I worked with an agency in Pennsylvania many, many years ago, and we did exactly that. We had every client who came in become an agency client first, and that was the entry point. And then if they were going to receive WIC or Head Start or LIHEAP or whatever other services, then their information was provided out to those other agencies. So that's one way to understand it, and eventually we'll have to get some greater understanding. It's a good question that you asked, Daniel, but it's something that we really don't necessarily know what funders will say. So the first step I think that everybody is saying is talk to the funders and find out what their flexibility is.
All right, well, thank you all. So the other questions I saw coming in were regarding the document that you shared. And so one person just asked to repeat the name of the document. So I went ahead and pulled it up for everybody to see again. And then I don't know what you kind of call this page, or if it's just based on the title.
I don't know. They're worksheets about understanding your data.
Okay.
And I'll send you a link that you can put on the Community Action Partnership or the full set of Excel files so that people have access to them.
Okay. Yeah, that was the other question, was about whether people could access these worksheets and use them in their own agencies.
Yeah, absolutely. Absolutely. That's sort of the idea. And I'll say that, so there's 3 parts, right? This is one part. There's a second part that's about when in your processes it's collected and where it's stored. And then there's a third part that's understanding if it's stored electronically in particular, how much control or access to it you have, which are all pieces of input into decisions about how do you get it into one place.
Okay, great. I just sent in the chat to let everyone know where those worksheets will be posted. They'll be posted in the same place as the slides are, as well as where the recording for this webinar will also be posted. All of that we keep housed in our Community Action Academy, which is an online learning management system. So we have courses for each of our open learning community groups within Community Action Academy. So if you already have an account, or if you create an account from the homepage, which is moodle.communityactionpartnership.com, then you would just go into the learning community, then go to open learning community groups, and then find the cultivating data-centered organizations. You just have to simply enroll yourself in that course, and there's going to be a button that just says enroll me. You'll just need to click that and then click to go into the course. And if you already have access to that, to Community Action Academy, then you'll just need to, you can follow this link that I sent in there to take you straight to the course. Let me check for, we just had another question come in as well from Gregory, and he is asking about qualitative analysis of various commercially available packages that meet the needs of CSCG Roma org standards, as well as complementary programs such as LIFE. So I guess, let's see, let me read it before I try to articulate it. Just talking about how there's no way to finance developing this type of software on a custom basis, and just talking about whether, you know, can't necessarily make recommendations, but if
I have some responses to that.
Okay.
The idea, the question really is, why is there not just a list of all of the commercial software pieces, and why is there not a recommendation for a single software set, or a way that it would be easy for everybody to use the same software? You know, this is community action. It isn't this idea that we're afraid that we'll be sued isn't really that's really not the motivation. The motivation really is that community action is about flexibility. It's about local needs. It's about local understanding. It's about the way each individual agency responds. And so it would be atypical for us to try to suggest a single way to do anything, because that's just not the way we function as a network. And looking at an analysis, there have been several analyses that have been done. We can try to find the one that that was done by Minnesota just a couple of years ago and see if we can't post that. Just some ideas about, you know, what the software does, and there's not necessarily an analysis of quality, because there again, it's quality based on the user. I talk to people across the country who have many different kinds of databases that they use, and I talked to two people who have the same software. One really loves it, the other one hates it. It's a matter of how you use it, what your capacity is, and so on. So the idea of quality and analyzing the quality of the different data systems, it's different based on what your needs are and what you want. So so this is a really Gregory, this is a really hard question, and it's just about it's about how that would happen, and it's not the driving force. It's really the driving force of the things that you heard from Paige and from Megan, and that Courtney reported on from the other agency, that it's really about thinking through the process, and then a data system, you know, any data system can work for you. You can make it work for you. So, so that's really the back end of the discussion. Those are all my opinions only. Anybody else on the call could throw in and give their opinion.
Can I jump in for 1 second? Because I want to say there's this fallacy. This is Paige. There's this fallacy in the world that we should create the one system that rules them all. It's the one system fallacy. And especially when you can create really good flexible systems. I think there are some out there, right? I believe in one I won't mention. But as soon as you try to require that, then it's not going to meet the needs of everybody, and it's not going to collect something that somebody thinks should be collected, or it may not match the processes of the agency as well as something else, right? Choice is a good thing. I think standardization in the data, right, so that we can pass around data, which is more about a data standard and about rules around what that would look like to pass information, even at the client level, it is a valuable conversation. That's where interoperability commercially with the business world is. That's where, you know, the health records, they don't have one system. They have HL7, which is a health data standard. So that would be my 2 cents.
Right, and it speaks back to your question, Gregory, that, you know, it's an analysis of strengths and weaknesses, but it's the strengths and weaknesses from whose perspective. I mean, there are just, as I said, one system might be strong in a certain area for someone, and someone else doesn't use that portion of it, and they think that's a weakness. So that's those are the challenges why this doesn't get out. It isn't because people are afraid of being sued, but it's that there's so many different opinions about what's needed. So it's a good question. It really is a question at the heart of our work.
Yes, very true. Okay, well, I'm not seeing any further questions at this point. If you do have any last questions as we're going through our final slides, please go ahead and type those in the chat box now to all panelists. But I'll go ahead and go over some of our final announcements so we can end on time. And we always like to let people know to follow our learning community blog. It's at lcrcweb.com. You can subscribe to be able to follow the blog and get regular updates. The blog, we've kind of added some new features to the blog and new ways that we write our blog posts. And we have some posts around fresh finds and, you know, so it's lifting up resources from the field and things like that. So just encourage you to check that out and see how we've kind of reformatted things and hopefully made it more helpful to you. We also have our CSBG TNTA Resource Center, which has hundreds of resources in it, as well as a way to submit TNTA requests. Of course, you can always email us as well. And then there's a consultant bank too, with a screened list of consultants who can offer training and technical assistance to the CSBG network. So I encourage you to check that out if you have not already. Then Community Action Academy is what I've been talking about throughout this webinar, and this is kind of where we create the virtual space for people to gather in between some of our webinar and learning community meeting events. So you can see the home URL here on the screen. It's noodle.communityactionpartnership.com. Accounts are free. They're pretty easy and quick to create. It just requires an email account confirmation. And then once you get into the learning community space, you can choose which open learning community you want to access information from. Those are open for anyone to engage. And then if you haven't joined those courses yet, you will have to click the Enroll Me button once you're in there. And then, of course, if you have any questions or having accessibility issues, feel free to email me, Courtney Kohler here at the partnership, and my contact information will be on the last slide. Our webinar Wednesdays, which is what you all are participating in right now, are these events that we put on for the National Community Action Network every Wednesday at 2 p.m. Eastern Time. We have experts come in and lead webinar presentations around our learning community group topics and promising anti-poverty practices. So you can always see our upcoming webinar events on the webinars page on our website, communityactionpartnership.com. You go to the events drop-down menu and go to webinars. But just to let you know some of the ones that are coming up in the near future, over the next month, we have next Wednesday, it's going to be focusing on decreasing homelessness. We have the National Alliance to End Homelessness presenting for us at 2 p.m. Eastern Time. So whenever you access these slides, you can actually click the links to register, or again, you can go to our webinars page. Then we also have June 27th at 2 p.m. Eastern Time. We are going to be focusing on our health intersections learning community. And we have Dr. Dana Long, our subject matter expert for that, is going to be presenting and talking about impact and evaluation on social determinants of health. And then on July 18th, we continue our collective impact mini-series, and we're going to be talking about the roles within collective impact and how to work with other organizations to develop a common agenda. So our subject matter expert for that group is FSG Consulting, and they run a national collective impact forum on the web. So encourage you to join in on those, and of course across the partnership and our other programs and areas that we work in and provide training and technical assistance in, there's lots of other webinars that we're offering also. So always just encourage you to check out our website to make sure you are up to date on the full range of webinar offerings across the partnership. Also, of course, just a plug for our national annual convention for community action that's coming up in August. It's the very last week of August, August 28th through 31st. It's going to be in Denver, Colorado. We have many sessions that we're going to be offering. I think the current count is somewhere in the 70s or 80s. So lots of different learning opportunities, general sessions, keynote speakers, and so we hope that you will come attend and network with your peers and learn together on many of these topics. And finally, our staff contact information. This is primarily our Learning Community Resource Center staff, as well as some of our training and technical assistance staff. And again, I'm Courtney Kohler, so feel free to reach out to me with any questions on today's webinar or follow-up materials. And of course, anybody else on our team for any questions you might have about the learning community. So checking for any last questions. I don't think I've seen any come in. Anything else from any of our panelists today? Barbara, Paige, or Megan?
I just want to say thank you to everybody. It looked like a really good big group, so it's exciting to see so much interest in using data well. Thanks for inviting me.
Sure.
Yeah, then I wanted to thank Megan for being on the call and being available to answer questions about how our agency is using moving forward. And thanks to everybody who has questions. Let us know if you have any others. You think about more questions as you look back at the maybe at the slides or at the worksheets or at any of the information. Just let us know what else we can do.
All right. Well, thank you all for presenting today, and thank you all that participated. And we will be following up with resources in Community Action Academy, and we hope you all have a great day. Thank you.